I just want to cover, to start with, what an injury actually is, because for me, things that come from nowhere and you don't actually damage yourself, that's not an injury. So an injury for me is something that goes twang, snap or pop. As I said, that's only about 5% of the injuries we see at the clinic. That's F45 people and general population as well. I think the main reason for that is that people don't want to pay money for anything that's going to get better on its own. So you give it 6 weeks minimum, and then it's the kind of the stuff that doesn't naturally get better. That's what we tend to see. After it goes twang, snap or pop, it will hurt a lot. You probably won't have any choice but to stop what you're doing, unless you're an American footballer or a rugby player. I've seen an American footballer that I treated, he wanted to go back on the pitch with a dislocated ankle. Thankfully, there was a physio on the side of the pitch that stopped him. So with these injuries, they'll continue to hurt quite a lot for a few days, but within 4 or 5 days, they'll start to feel a little bit better. We can give you some kind of strengthening, some stretching exercises, and within 6 weeks or so, things should be pretty much back to normal. 6 weeks is the key figure. It's 6 weeks is kind of what we call physiological healing. That's how long tissues take to heal. And that's pretty much across the board. Any kind of ligament, muscular injuries, etc., etc. Even ankle injuries as well should be all done and dusted in 6 weeks. There are complications, but we'll talk more about those as we go through. So that's an injury for me. The next thing is, okay, well, if that's an injury, what are these things where, and I'm sure pretty much everyone in the room has had one of these, where, oh, my knee started hurting today. Well, where's that come from? You know, why has that started hurting today? They normally come on typically over months or years, probably come on gradually. Might be a leftover of something went snap or twang or pop previously. Might be a reminder of something very painful in the past, whether that's physical or emotional. There's not normally a specific reason. Some days it's worse than others. You know, like, well, what on earth is going on here? So if there's no problem with the tissues, why do you feel the pain? For me, in my experience, what I've discovered is, or what I believe is that injuries, they're not so much injuries, but accumulation, and this is very catchy. Accumulation of biomechanical and emotional issues. I'm going to try and trademark that, but I don't think it's going to go too well. So if there's no problem with the area where you're feeling the pain, because no tissues have actually been damaged, why would you feel pain? Now, for me, it's the scapegoat site. The real dysfunction lies elsewhere, but where you feel the pain is the most vulnerable area along that line of dysfunction, if you like. So coming back to your ankle example, the classic one is that when it hurts like hell in those first few days, you've got to get around, you start doing this. That changes that movement pattern. And then as the tissues heal within 6 weeks, it's the movement pattern that then maintains the pain mechanism, and you have to interrupt that and change that.